Hello A&P students, this is Mr. Becker here to talk about the structures that we find in the os coxa. The os coxa is composed of three individual bones that fuse together. We have the pubis, we have the ischium, and we have the ilium. All right, so we're going to talk about the structures of the ilium first. All right, so if I rotate the os coxa like this, we can see the iliac crest up here, and then we have the anterior superior iliac spine and the anterior inferior iliac spine on the front side, and then on the posterior side we have the posterior superior iliac spine and the posterior inferior iliac spine. Sitting directly underneath the posterior inferior iliac spine, we have the greater sciatic notch, this very large notch in the bone right here. And then if we take a look at it from the inside, this very large structural feature right here is the ala, A-L-A, of the ilium. And that is going to be right next to the ala of the sacrum. The ilium is divided from the ischium and the pubis by this line right here, in 3 dimensions that I kind of tilted around. You can see it. This is the arcuate line. And coming back the arcuate line, we make our way to this kind of L-shaped surface right here. This is the auricular surface of the ilium. The auricular surface of the ilium is going to articulate with the auricular surface of the sacrum to form the sacroiliac joint, and that is what joins our vertebral column into our os coxa. All right, structures on the ischium that we want you to identify. We have the ischial spine located right here, directly underneath the greater sciatic notch, and then directly below that, if I tilt it back and forth a little bit, you can see it, this is the lesser sciatic notch. And then under the lesser sciatic notch, this large tuberosity right here is the ischial tuberosity. This is going to be the site of origin for the hamstring muscles. And that leads into the ischial portion of the inferior ischiopubic ramus, located right here. The bone of the pubis is found right here. This is the main body of the pubis, and we form 2 rami, 2 arms that are going to come off of this. All right. The pectineal line of the pubis is a continuation of the arcuate line and is going to lead out toward the fibrocartilage pad of the pubic symphysis, which is located right here. The first ramus that comes off is the superior pubic ramus and ends at the pubic tubercle, located right here. And then we have the inferior pubic ramus that is going to join with the ramus of the ischium, and collectively we usually refer to these as the inferior ischiopubic ramus. When we put the 2 rami together with the body of the ischium and the pubis, we form a large hole here, which is the obturator foramen. And then located next to that, we have the acetabulum. The acetabulum is the socket into which the head of the femur is going to sit. And then none of our bones are going to show this, but along the outer rim here is where we would find the structure that we call the labrum of the acetabulum. Right, the labrum is connective tissue that is there to help deepen the joint and to stabilize the joint. And we find that same labrum up on the scapula to help with our shoulder joint as well. There's going to be a labrum there. So these are the bony structures of the os coxa that we are interested in for Lab 7.